For this video, we're going to demonstrate some scenario and discuss the management for poisoning. Hello, I'm Rogma Ulanin.
I'm Jaira Tison, and now let's start our discussion.
There are various causes of poisoning, and the main reasons are food poisoning and chemical ingestion. Now here's what you need to know when approaching a poisoned person. And there are two separate parts. Each of them has multiple steps. First is diagnosis with 3 steps in it, and treatment with 5 steps in it, which occurs simultaneously. Now let's discuss first the diagnosis. Step 1 is history. You should know what the toxins are and what time the toxins ingested. Step 2. Physical examination. You should check the patient's temperature, heart rate, respiratory rate, blood pressure, size of pupils, skin color, and level of consciousness. Step 3. Diagnostic test. There are few selected blood tests to know the blood gas, anion gap, and specific drug levels. An ECG, EKG, or electrocardiogram is helpful. Now let's move on with treatment. Step 1 is ABC stabilization. Make sure that the patient has patent airways. Give oxygen if oxygen saturation is low. Give IV fluids or intravenous fluids for hypotension. Step 2. Blood sugar and opioid reversal. Check blood glucose and give dextrose if it's low. If suspecting opioid overdose, give opioid antidote. Step 3 is decontamination. Get rid of toxins by different needs. Irrigate if it's on skin. Remove from GI or gastrointestinal tract if blood is ingested. Step 4 is antidote. If the poison is figured out or identified, you can now give a specific antidote. Now step 5, supportive treatment. This is when there's no specific antidote to treat the symptoms. Now there's common specific causes of poisoning, and these are from foods and chemicals. Here are some common scenarios and what you need to do. From being poisoned by food, symptoms are upset stomach or stomach ache, nausea, vomiting, diarrhea, fever. The following symptoms may appear 1 to 24 hours after eating contaminated food. As you approach a person with upset stomach, ask the person, "What did you eat? When did you eat? And where did the food came from?" You may feel the person having fever by touching its forehead and cheek. Casually lay down the person. Call a doctor or emergency medical hotline. Ask for their advice on what to do. Do this as quickly as possible if the person is particularly vulnerable. For example, an elderly, a child, or a pregnant woman. If the person vomits, it is advisable to keep the vomit to show the doctor, but don't force them to vomit. And also give some suspect food for them to identify which germ is responsible. Have them drink lots of water to avoid dehydration. Always monitor the person's condition if it's still not being taken to the hospital. Now how about on chemical poisoning? Most cases of chemical poisoning involves drugs or cleaning products. First, find out the toxic products has been ingested. Try to determine how much ingested and when. If the person is having trouble breathing, set them down or help them into position that ease their breathing. Call the emergency medical hotline and give them the information that you have and follow their instructions. Do not give the person water or something to drink. Do not make the person vomit because the toxic product will burn the lining of their mouth and esophagus the second time on the way out. Act fast according to the person's condition. If they lose consciousness but still breathing, place them in recovery position and monitor them until medical help arrives. If they stop breathing, start cardiopulmonary resuscitation, altering 30 chest compression and 2 rescue breath. If you don't know how to do the mouth-and-mouth breathing, do the chest compressions only to rate 2 per second. Be alert, knowledgeable, calm, but fast on response. Be safe, thank you, and goodbye.